Welcome to Healthcare Beyond Scrap. My name is David, and thank you for joining us in today's episode where we're going to look at the role of the environmental service in care coordination in terms of, supporting patient care. And so today I have a guest with me that is going to help us have a discussion into this topic, and she works in that environment, so she will have more insight into what they do compared to me. So that's why I have her here. And my guest is Emmy, who is an environmental service person. And so she's going to tell us a little bit more about herself. So welcome, Emmy, to the show. Can you please tell us a little bit about yourself?
Thank you so much, David, for having me here. My name is Emmy, and I'm a EVS Tech. Stands for Environmental Services Technician. I work in the greater Seattle area. And I've been working in this field for 1 year and worked housekeeping 2 years before that. So thank you for having me.
Yeah, thank you. And thank you for joining us today. If we talk about environmental service people, with being a nurse on the floor, all I think about is, people who come on the floor and then work. So you're going to tell us a little bit more about what you guys really do.
Yeah,
and then so we're going to look into that. Well, but before we start, I have a little joke here that we're going to try. Okay.
All right.
So it's around what you guys do. So around what EVS does. So the first one is, why don't EVS staff play hide and seek?
Why?
Because you guys find every spot. I think that's a good one.
Yeah, that's a good one.
So you cannot play hide and seek with the EVS person.
We're everywhere.
You guys can find all the, all the spots that need to be found. Okay. And then the last one I'll have for you. How do you know that the EVS team has been thorough?
How?
Because they have everything cleaner than your conscience. I think that is fair. You guys do a pretty good job in cleaning.
We try.
So, yeah. So, I mean, all we know is that you guys clean, but do you just get hired and start cleaning, or do you have to be trained?
That's a good question. We do get trained. So before we get hired, we have a 2 weeks training with a preceptor, and they'll teach us how to clean isolation rooms. If you're, for example, working in an ICU or operation room, you need to be extra careful about the walls, the ceilings. Believe it or not, we clean the ceilings.
Okay, so you get trained, right?
Yes.
And so it's more like, is it on the job training kind of thing, or so can I just come off the street and say apply for a EVS position?
So I would say you don't need any prerequisite, but it does help in the application process to have prior housekeeping experience.
Okay.
But yeah, you come in and you train on the job.
Oh, nice. So with you, right? Mm-hmm. So how did your story or your journey begin for you in getting into the environmental service? Well, like, what did you do before, and what influenced your decision to become, an environmental service person?
So I started off being doing something completely different. I worked in Japan as an assistant language teacher, and then I went to work as a pet shop, and that's where it started. I cleaned the pet, what do you call it? Showcases.
Oh, showcases. Oh,
and then you need to clean it very well to make sure that the little puppies don't get infections, because you see the consequences of not cleaning the cases. So from there, I moved over to the United States 3 years ago with my husband. He's American. And I knew I wanted to work in healthcare.
Yeah.
So I gave physical therapy try. Yeah. And then I take phone calls. I looked at patient care activities, but the most fun thing I had to do was cleaning the beds and making sure they were clean. So I thought, oh, why not just go with it, you know? And then I started working as a housekeeper at a nursing home. And then I said, well, let's keep going. Let's keep doing this. And then I went out of I was interested in possibly going into management or supervisor roles. Okay. So I went into hotel coordinator. Yeah. But then I realized, no, I want to be on the job. I want to be cleaning. I don't want to be sitting here managing the bed. So I went back and applied for my current role, and I'm really happy with it.
Well, see, and that's what we keep saying on this show, right? It's finding what you love to do, and because there are people who go like, why would you take a managerial role and then leave it? But that's not what makes you happy, right? Yep. And I think when you find what makes you happy, it makes the job easier, right? And it makes you enjoy what you're doing as well. So,
absolutely.
Yeah, I mean, good for you that you.
Yeah, thank you. It took a long route, but I came back and then here I am. Yeah.
So, I'm happy for you that you found that.
Thank you.
So you, from Japan, you went to did work at a pet shop. You love the cleaning and how realizing the consequences of it. How does that translate or relate to especially working in the hospital, right? Because I can see, in my opinion, like the consequences of not cleaning the cages well or the showcases well.
Yes.
The infection it could. Does it translate in terms of patient care as well?
Yeah, absolutely. That's what I think about when I'm working, because when I used to work at a pet shop, the dogs, they're puppies. So when you get an infection, the next day or the next few days or a week, they have symptoms. Whereas when you're working in the hospital, being an EVS worker, you don't necessarily see the direct effect of your cleaning. Whereas looking back, seeing their symptoms of your puppies, that at the back of your head, you're like, okay, this is the same. You're preventing infection.
Yeah, and that's important, right? Because like you made a very important point here about, as an EVS person, you do your cleaning, you leave, you don't see the effect if that job is not done well. But as a nursing staff, you do see the effect if a place is not cleaned well, right? The contamination that could lead to infection or cross-contamination and stuff like that. So what you guys do is actually the bedrock, of infection prevention, right? And so I think you guys play a very important role that is often overlooked, and in terms of supporting patient care and stuff like that. And I was hoping that unfortunately the role you guys play is like you clean the room and leave, so you don't really see it. But at least for you who have been with the pets, you have an idea of what is. Yeah, and hopefully, I don't know how the training is like. That's your training until like the explanation of what this could lead to if it's not clean, the places are not clean well. Do they train you guys on that, letting you know like the potential effect of?
Yeah, that's a great question. And I think I'd love to see more of that training of what the real effect.
Yeah, the real effect, let's say, of not cleaning the places well, of it, the impact of the job.
The impact,
right?
Absolutely.
Yeah. And then, so EVS, are there different type of environmental service people?
Yeah, so there is two big roles, and within that one role, there's more. But for example, myself, I'm an EVS tech. So we go into patient rooms, clean isolation rooms, for example, or go in to operation rooms or hallways, those areas. And there's another role called EVS project tech, at least at my hospital. And then they they usually clean the floors. They know how to scrub, wax the floors. They know how to clean, fix little things. So they're more specialized.
Okay. So, and those are project techs?
Project techs,
techs. Okay.
We love them.
I've never heard of the project techs before. That's interesting. And that's good to know. So then, are there any like any kind of group that works outside the hospital setting that are EVS as well?
Oh, a good question. Right, currently we don't have any, but sometimes we do have when we have a high census and we need help. We call contractors to come in to clean the hospital, help us make sure that we keep our cleaning up to a standard, because when we're low staffed, we tend to
with the importance of your job, you don't want to rush the cleaning at all. I think oh, that's interesting to know. Okay, so sometimes you guys do get help from outside, contractors and stuff like that to help clean the place and stuff like that. I love that. That's really good. It's good to know that we are safe or we are practicing safely than not knowing what goes on when you guys are short staffed, right? So I'm happy to know that you guys do get help, from outside like that and stuff like that. So what are the steps? Let's say if somebody is from a patient is coming, or a patient has been discharged from a room, and you are being asked to come clean the room. What are the steps that is there a system that alerts you, or how do you know that you have to go clean this place?
Good question. Currently we use this app called Epic. I'm not sure if you guys use as well. So it will send the nurses or the techs would send us a room, and it will go to the lead. The leads would then send us a message on our handheld device that says we have a room. We accept, we go to the room, then we say we're working on it. And then we have a certain amount of hours, time or minutes to work on the rooms. And then when we're done, we click complete. So we let the lead and the nurses are able to see how far we've been gone through until completion.
And how do you feel about the workload?
The workload, I would say, considering I've worked at different places like hotels, nursing homes, train, railroads, it's very good. The fact that we have union really helps.
Oh, okay.
Yes.
So compared to like other places that you've worked, you think that the hospital workload is much better?
Much better.
Okay. Well, I'm glad it's like that, because we need a place to be, safe for patients. So I'm very happy to hear that it's much better, the workload. When you talk about spills, I want to talk about spills. As a nurse, you get trained and told when you have spills and stuff like that, you call EVS if you are not trained to clean. Are you guys trained on how to clean particular spills and stuff like that?
So same as the nurses, we have certain EVS people that are not trained yet, and people that are. So the people that get sent to take care of these biohazard spills are people who are trained.
Trained to do that?
Yes.
Oh, okay. So is this something that you have to ask to be trained or apply to be trained, or they just select people to be trained?
So I believe they ask you to be trained if they would like you to be trained. Or for example, if you're a lead, then all leads must be trained.
So for you, somebody who has no experience and want to be an EVS person, and then in the hospital setting, and then for you like this, you went through a different route. You had the hotel, railway, and stuff like that before. If I want to become, I want to get into, this work or this kind of role, what would be your advice? Do you think it would be better to get this outside experience before coming to the hospital, or it is okay to just apply and get in?
So if you're lucky and you apply and get in, good for you. I would love that for you. It's a great place. It's a great way to get your step in the door into especially if you want to work in a hospital. But I I would say getting experience, any housekeeping experience outside of the hospital would raise your chances of getting this role.
Okay.
Yeah.
And I have seen people also from EVS to become maybe sometimes CNAs. I've seen people from EVS CNA to RN. I recently even saw a video of a EVS person who became a doctor, right? So yeah, I was like, that's a big leap and jump, and it's beautiful.
That's beautiful.
Yeah, and my question is that do you think that brings in a different kind of exposure and experience to, let's say, if as a nurse, if I had had an experience as an EVS person, do you think it would have made a big difference on my understanding on how cleaning in the room goes and what goes into it and how it impacts patient care?
I would even say it might be a great learning experience for nurses to even go be try working as an ES for a day or two. You know, I think it would be a better have a better patient outcome just to have the mindset and know where we are and how we work. Yes.
I love that. I've never thought of it actually, like to say volunteering and as an EVS person, just to have the feel of what you guys do and what goes into that. Because at the end of the day, I always say if we understand what goes into each other's role and work, it helps us to coordinate better and understand each other better in that sense. So I think I agree with you, and I never thought of it as volunteering, right? But I think it's a good idea if anybody gets a chance as a nurse and you want to volunteer and just see what goes into you guys' work.
Yeah, what a wonderful world is that? That could happen.
Let it happen.
Let it happen. Yes.
You clean patient rooms. You communicate with nurses on the floor sometimes.
Yes.
You do have your lead and team that you work with. I'm going to put you on the spot.
Uh-oh.
What are some of the things, or even if one thing that nurses do that you wish they never did?
Ooh, am I gonna make some nurses upset?
Hey, feel free.
Okay, it's a safe space.
Yeah, it's a safe space. We are here to learn, because I ask these questions because I kind of feel if I know, then next time when I see an EV-based person, I know what not to do.
Okay, listen up, guys. So we have discharges, patient, you guys are really busy. You're doing really important work, and everybody, we appreciate what you guys do. Nurses work so hard. But we would love if you guys could, take out do you finish your part, the commodes, the IVs, help out with some of the linens if possible. That would make us finish the floor, make the room ready for the next patient to come in.
So that's a very important thing to know, right? Because from what you said earlier is that you guys are allotted time frame to finish your work.
Yes.
So that means the more mess we leave behind, the longer it's going to take.
Yes.
And even if you have to hurry and finish the job on time, that means not being able to clean as much as you would love to.
Exactly. Yeah. And when we try to clean the room correctly, we will go over that time frame. And if we find that it's a necessity because patient safety comes first, we will clean over that time. But it would help.
Yeah, it's good to know. I've never thought about that. Where I work now, right, it's like when a patient is discharged, we strip the room, remove the linens and stuff like that, which, chants into what you said about, helping with those stuff, right? The hospital I worked before, we didn't do that. That's the responsibility of the environmental service. Patient is discharged, we call you guys and you guys come deal with it.
Right. Makes sense.
But you saying this bring a little insight into, the impact it might have on you guys' work, and the quality of work too. So that's very good to know. Thank you for sharing that.
Thank you. I love your questions.
And then again, I have another one.
Okay.
Is that what do you think nurses do that you want them to keep doing more?
Okay, so certain nurses, and we love these nurses, they make eye contact and then they just smile at you or say, hey, how's it going? And that really lets us know that, we're working as a team. That little gesture really goes a long way.
Yeah.
I wish they keep doing what they do.
Yeah. Thank you for sharing that. Because communication is important, right? And being able to saving high to I have seen cases where, like, some staff, not only nurses but even other departments, where you see each other in the hallway and just pass each other as if they were not, they didn't exist as human beings, which doesn't help, right?
Right.
Yeah, just a little hi, or how is it going?
Even an eye contact.
Yeah.
It goes a long way. It when I know that I'm going to a certain place and I know there's these nurses, I'm like, yes, today's going to be a good day. and then when I know that I'm going to a different department, I'm like, okay, I'm gonna be prepared for this, and I'm gonna hold my head high. I'm gonna do my job well, whether or not.
Yeah. These little things go a long way, right?
Mhm.
This little thing, that's very good to know. I remember an instance where this was not an EVS person, but it was a phlebotomist who was coming to draw blood. And those years, I used to be a CNA, nursing assistant. And I was like, I was doing one-on-one with this patient because the patient was violent, right? And so they had me watching that patient, and this patient was in restraint, and I was sitting in the room observing this patient. Here comes a phlebotomist who walked into the room and saw me and just passed by me like on a piece of wood, went straight to the patient and tried to draw blood. This patient nearly kicked the life out of her. She jumped back and looked at me. I'm like, am I here? I don't know.
Am I even here?
Am I even here? Does somebody see me? Am I even here? And she felt so bad, she couldn't talk to me. She went out to call her colleague to come and help her. And I'm like, you could have just said hi. And I feel like if she said hi, I could have said, hey, be careful, this is a violent patient, I could help you, anything. But just walk right by me like I didn't exist. And when that happened, when that happened, she just felt bad and just walked back out to look for help. And I'm like, just a little hi.
Absolutely. And it's better communication, better patient care, better outcome. And I love that you raised this example. This is how we feel too sometimes.
Yeah. So that's good to know. I'll be saying a lot of hellos now. I think I'm pretty good at, saying hi to other departments that I see on the unit, especially because I feel it bridges the gap between, we are environmental, so we are nurses, we are CNA, so we don't communicate. No. I love chatting with my environmental service people. I like chatting with my CNAs. I have built that connection and relationship with them. And so knowing that it goes a long way, I think I'll be doing more of that.
Thank you. And you doing that and being that change will have a ripple effect. And it does.
Yeah.
I know one nurse in one of the unit, she brings such great energy, and any new nurses that come, they see her doing, saying hi to us. And the whole unit becomes a very nice place for us.
Nice. That's good to know. I remember I know, and one of our EVS persons where I currently work, she would always pick a trash. I liked sitting in a particular corner, and every morning she would pick a trash can behind me. And I make sure anytime she gets to me, I'll say good morning. And it got to a point, anytime I see her, even in the hallway, she also say hi to me.
Yeah.
So
I love that.
Yeah, I think that goes a long way.
Yes.
Not for only you guys, but for us too, right? Because it's good to know you're in a friendly environment and everybody's being supportive.
Yes.
Like you said, you are visible, you are seen. You are not a ghost on the people see you and not see you. So yeah, thank you for sharing that.
Thank you.
I'll be doing more of that for sure. So before we leave today, is there anything that comes in mind that you would like to share, if with other healthcare staff, right?
Yeah, absolutely. So, I think if anybody, young people, any age really, if you're interested in supporting patients, interested in the healthcare field, just want to try it out, it's a great opportunity to come in without any certifications, and you get to see how nurses work, see what nutritionists and the nutrition staff do. You make so many connections and people, and you get to know all these people. Even the maintenance techs,
Wow,
yeah.
that's
I
yeah.
say hi to them all the time.
Yeah,
Like, what are you doing
yeah.
today? They're fixing something, in the havoc or whatever,
Yeah, and you guys' work, right? You made important points, getting to meet other staff, because with what you guys do, you go everywhere.
Yes, you get to
And
see
everybody, right?
Yes.
Unlike with the nursing staff, sometimes you're stuck on your unit. Once in a while, you
Right.
go outside the unit, but most of the time, you spend most of your time on one unit,
Right.
which is your unit. But you guys go everywhere.
Yeah, and that's really what I love about this. You're not stuck on a desk. You're walking around. You're saying hi to people. You see patients. It's pretty cool. And one more thing is, really, you have one body. It's same as nurses. You're on your feet all the time. You're lifting heavy things. You want to be careful and make sure that you have good body mechanics, and take care of your
back.
body, your back,
I
your
think-
shoulders, your repetitive movements.
Yeah, I think for healthcare workers, our joint is one of the big things, right?
Absolutely.
For us to protect.
Yes.
If we want to continue or maintain longevity in the field, right?
Yes.
So yeah, thank you for sharing.
Yeah.
And thank you for coming on this show.
Thank
I really
you for having me.
you. And it's been a wonderful conversation, knowing what you guys do and stuff like that. And the good thing for you viewers is that you don't need a particular certification. You don't have to stress yourself about prerequisites. This is not like the nursing job or nursing assistant job that you have to, go for a certain prerequisite. You use this long route to just try to get in. It's a first step into healthcare environment to gain experience and knowledge about what goes on in there. You can start from the environmental service position, which you don't need any special qualification for. You'll be trained on the job as well. And one good thing for you to know is that they are the bedrock of safety and infection prevention in the hospital. These people, without them, you will have a dirty room, you have a dirty hospital, you have infection, contamination, and transmission of infection from person to person everywhere. So they prevent the disaster, they prevent the chaos from happening, and we love you guys. So thank you for coming today. We appreciate you. If you watch us to this point, thank you for staying tuned, and we'll see you in the next episode. This is the show that is called what? Healthcare Beyond Scrub, and where we have real conversations just like this one. Thank you for joining us, and see you in the next episode. This is David, and I'll see you soon.